In this episode of the podcast, Dr. Marty Makary, a prominent surgeon and author, discusses the alarming state of healthcare in America, highlighting how a small group of elite experts has hijacked the medical system, leading to widespread misinformation and poor health outcomes. Dr. Makary argues that despite significant advancements in medicine, the population is sicker than ever, and the healthcare system is failing to address the root causes of chronic diseases. Dr. Makary begins by emphasizing the increasing centralization of authority in medicine, where a select group of experts controls health recommendations and research funding. He expresses his love for practicing medicine, but is concerned about the dogmatic approach that often overshadows scientific evidence. This elite group, which he refers to as a priesthood, has a track record of making significant health recommendations that have proven to be incorrect. The result is a stagnant medical landscape, particularly in areas like Alzheimer's, mental health, and nutrition. He points out that many doctors are now challenging the traditional medical establishment, advocating for a more holistic approach to healthcare. Instead of merely prescribing medications, these doctors are exploring alternative treatments, such as cooking classes for diabetes management or addressing sleep quality for hypertension. Dr. Makary believes that the current system is converting American children into a generation of patients, neglecting the conversation around food as medicine and general body inflammation. A significant part of the discussion revolves around the relationship between big pharmaceutical companies, the National Institutes of Health, and academic institutions. Dr. Makary argues that this collaboration leads to groupthink and discourages dissenting opinions. He recalls instances during the COVID-19 pandemic when it was challenging to discern whether recommendations were coming from independent experts or pharmaceutical companies. This lack of transparency has created an environment where doctors are hesitant to voice their concerns for fear of repercussions. Dr. Makary highlights the example of frenotomy, a procedure performed on newborns to cut the frenulum under the tongue, which is based on unproven theories. He argues that such practices should be subjected to rigorous randomized control trials to determine their efficacy. The medical community often rushes to adopt practices without sufficient evidence, leading to widespread misinformation and unnecessary procedures. One of the most striking examples Dr. Makary discusses is the rise of peanut allergies in children. In the early 2000s, the American Academy of Pediatrics recommended that children avoid peanuts to prevent allergies. This recommendation, based on limited evidence, led to a dramatic increase in peanut allergies. It wasn't until years later that research revealed early exposure to peanuts could actually prevent allergies. Dr. Makary criticizes the medical establishment for not acknowledging their mistakes and for failing to apologize for the harm caused by misguided recommendations. He argues that the medical community's inability to admit when they are wrong contributes to the growing distrust among the public. People are increasingly skeptical of health recommendations, especially when they perceive a lack of humility and transparency from medical authorities. Dr. Makary also addresses the topic of alcohol consumption and its impact on health. He points out that while alcohol is often glorified in society, it is a leading cause of preventable death. He emphasizes the need for a more nuanced conversation around alcohol, acknowledging that while some studies suggest potential benefits, the overwhelming evidence points to its harmful effects, particularly on liver health. He highlights the importance of addressing chronic diseases through lifestyle changes rather than solely relying on medications. The average American is now the most medicated generation in history, and Dr. Makary believes that the focus should shift towards preventive measures such as diet and exercise to combat the rising rates of obesity and related health issues. Throughout the podcast, Dr. Makary encourages listeners to question medical dogma and to seek out diverse perspectives. He believes that the future of medicine lies in fostering an environment where dissenting opinions are welcomed and where innovative ideas can flourish. He cites the example of the COVID-19 pandemic, where many doctors felt pressured to conform to the prevailing narrative, even when they had reservations about the recommendations being made. Dr. Makary's own journey in medicine has been shaped by his desire to challenge the status quo. He recalls moments during his training when he felt disillusioned by the rigid adherence to outdated practices. His experiences led him to pursue a career in public health, where he could advocate for systemic changes in healthcare. As the conversation progresses, Dr. Makary emphasizes the need for a paradigm shift in medicine. He argues that the current system is not equipped to address the complexities of chronic diseases, which require a more holistic approach. He envisions a future where healthcare providers focus on the whole person, considering factors such as nutrition, mental health, and social determinants of health. Dr. Makary also highlights the importance of funding research that explores innovative solutions to health problems. He believes that the National Institutes of Health and other funding bodies should prioritize studies that address the root causes of chronic diseases rather than solely focusing on pharmaceutical interventions. By empowering researchers to explore new ideas, the medical community can uncover valuable insights that could lead to better health outcomes. In conclusion, Dr. Marty Makary's insights shed light on the critical issues facing the healthcare system today. He calls for a reevaluation of the way medicine is practiced, emphasizing the need for humility, transparency, and a willingness to question established norms. As the medical community grapples with the consequences of its past decisions, Dr. Makary's message serves as a reminder that progress in medicine requires open dialogue, innovative thinking, and a commitment to prioritizing the health and well-being of patients above all else.